Welcome to our show, Health and Wellness, Myths and Facts. I'm Ambika Singh Kama. A few weeks back, it seemed that the COVID pandemic was in its last stages and we were hopeful that it will end soon. But the emergence of Omicron has thrown all our projections of 2022 into disarray. Even though we have a variant which causes a mild infection, it can affect the vulnerable and the unvaccinated population. Due to Omicron's high rate of transmission and danger to unvaccinated and unboosted people, hospitalizations could rise dramatically in the coming months. People with chronic diseases should be more careful about the management of their conditions during this phase. Chronic diseases are the major cause of death and disability worldwide. The total number of people dying from chronic diseases is double that of all infectious diseases. The two most common and leading causes of death are diabetes and heart disease. Altered lifestyle is a common risk factor in all major chronic diseases. With the pandemic, chronic diseases are on the rise. Social media use has increased in emerging and developing nations in recent years. People may get misguided due to medically incorrect and unverified content. Expert advice will help our viewers get medically correct information and act accordingly. Let me introduce our panel today. We have with us Dr. Baburajendra B Naik, MD Diabetology, Masters in Diabetology, MHSC, FIAMS, PGC Diab, Chief Diabetologist, Shri Tulasi Girish Diabetes Hospital and Diabetes Research Foundation, Bagalkot, and Dr. Bhavanadhar, MD, DM, FACC, FSCAI, Chief Interventional Cardiologist, Mamta, Academy of Medical Sciences, Hyderabad, Hiranya Heart Care, Montreal. Thank you all so much, doctors, for joining us today for this interesting conversation. Starting with you first, Dr. Naik, when the COVID pandemic hit the world, masking was something which we all were talking about. Even now we hear that we see people not wearing masks properly. Tell us, at this point when we talk about Omicron, when it is highly transmissible, is one mask really enough or should we be wearing a double mask?
Very valid question, madam. Yes. The question which is widely asked and widely did in propaganda from even the patient point of view and general public point of view. Even in COVID, in the first wave, in the second wave, we did get this question across. So let me clear that this one, the single masking is more than enough to keep you safeguarded from any sort of, whether it's a COVID infection or Omicron. If you are working in very dense areas, very highly populated areas, and if you're a healthcare worker, it's advisable to be on a double mask. And people who are working in ICU, these are all the places where N95s are very much mandatory. So for general public, single masking is more enough to be in the safer side. So my advice, kindly follow SMS and use masking all the ways when you are stepping outside the house.
Okay, thank you for explaining that well. So yes, we do know masking is key. Dr. Bhavanadhar, RT-PCR test is commonly used to detect coronavirus. Can Omicron be detected by the RT-PCR tests? And which additional tests are recommended to detect Omicron?
Yes, this is a very important question, and many of them are thinking of this question because coronavirus is a RNA virus. Coronavirus is an RNA-based virus. RT-PCR detects the RNA levels in the sample, and Omicron is a genomic variant of coronavirus, which needs genomic testing. RT-PCR doesn't test Omicron directly.
Okay. Yes, please go ahead.
Yes. And out of all the RT-PCR samples collected in the positive samples, the genomic testing is done to see how much % of Omicron is there. Through that, we get a estimate how much Omicron is prevalent in the general population, or of all the positive samples, how much Omicron is present.
Okay. Thank you so much, Doctor. Dr. Naik, tell us, Omicron is a milder infection, but it can it be milder or less severe in the elderly people with diabetes too? And what precautions should the elderly people be taking at this point?
A very apt question, madam. As of now, all are afraid of the possibility of the third wave, and we are contributing to the Omicron virus. Omicron virus, as of now, what experience we are sharing past few months, Omicron, as of now, it has behaved very soberly, and it's not that much, it has created havoc or chaos in the healthcare system.
Yes.
As of now, it's a very milder version. like any flu, we can say so, but it may cause some problems with the elderly people who are suffering from the comorbid conditions like diabetes, hypertensive, ISD, COPD, tuberculosis. These are the people we need to be doubly sure. We need to safeguard them from getting into Omicron or this COVID infection, because it can be an double trouble for the people who are suffering from comorbid conditions. So for these people, we need to practice SCMS, that is a social distancing, masking, and sanitizing is a very must. And my message to the people who are taking care of the elderly people at home, kindly keep mask when you are stepping out of the house. Don't step out unnecessarily unless it is warned. Yes. And when you are at home, kindly sanitize your hands frequently so that you will be safe and you will be keeping your elders at the in the safe zone. So my request, kindly practice SMS and keep your elderly people at the safe zone.
Absolutely. I think SMS is key here. Masking the right way is very important. Socially distancing and of course sanitizing and keeping our hands clean is important. But the ones with comorbidity should be extra careful and more precautious. Dr. Bhavanadhar, what is a vaccine booster dose and how does it help bolster your body's immunity against COVID-19? And what really is the difference between a vaccine booster dose and a vaccine third dose? There's not too much clarity on that.
Yes, this doubt, I want to clarify through an analogy. Coming to analogy with a cricket match, we can put like this, that the actual match we are going to play is the infection which we are going to get. The vaccine is like a practice match, wherein we are making our immune system practice for the upcoming infection. If the person gets infected, the immune system is ready. So each vaccine has different doses needs to be administered. Some vaccines require one dose, some require 2 doses, some require 3 doses. And once the immunity wanes off, we need to take a booster dose.
Okay.
I give example with this hepatitis B. For hepatitis B, as such, the immunity requires 3 doses. And high-risk population need to take a booster dose once in 5 to 8 years. The same thing is with the coronavirus vaccines which are available in our country. They require 2 doses. First dose followed by a second dose and a booster dose to increase the immunity or bring back the memory as it wanes off.
Okay. So the booster really increases or boosts the efficacy of the 2 doses which we've had before. Thank you for explaining that. Dr. Naik, diabetes is a disease of complications. It affects many organs of our body. Which diabetes complications are common in older people and what is the best way to really prevent it?
Very good question, madam. This is the very repeatedly asked questions in our day-to-day practice also. And the patient attendants will be very much apprehensive to keep their elderly in the safe way. The most common complications what our elderly people come across will be the macrovascular complications, what we call it as. The macrovascular complications consist of the cardiovascular and the cerebrovascular complications. And in cardiovascular complications, it can be an ISD, heart failure. These are the commonly encountered complications what we see day to day. And many studies have given a robust data that the diabetic elderly people are most commonly they suffer from macrovascular complications due to uncontrolled diabetes. So we need to keep these people safe from there's a CVA and coronary artery diseases, cerebral complications, and they may have acute kidney injuries and respiratory tract infections also very much common in these people. So most common complications what you can label as a number 1 is cardiovascular, second comes the cerebrovascular complications, and for these people getting into these complications, the only mantra what we have in our hand is best diabetes control possible as much as, and we need to keep the targets levels within the normal so that we can prevent our elderly people getting into the complications. We need to counsel them regularly to be compliant with the medications what we prescribe, and we need to counsel them and re-counsel them whenever they visit every time to our OPDs. So this is how we can prevent our elderly people landing into the complications, and we can keep them long. I can give them a good quality diabetic life to live them healthy, long life.
I think absolutely that's key, that they keep taking their medications, managing diabetes really well and extra cautious about cardiovascular as well as renal. Dr. Bhavanadhar, we were talking about vaccines, the booster dose. You explained that to us. Tell us about vaccines for children. When we talk about Omicron, how safe is it for them? Because now vaccination has started for children.
Yes, the vaccination for children are meticulously given after giving a trial, and as of now, the government of India and the committee which has given the green signal to give vaccinate the children have collected the data from the multiple studies, and the studies which have shown that a good efficacy in giving these vaccines to the children. And definitely, as it is protecting the adults, definitely children have to go for the vaccine.
Yes.
And according to the government guidelines, we have to go ahead and vaccinate the children, so that the severe stages of the COVID virus and the coronavirus, especially in children, a newer syndrome called multi-system syndrome is being seen, which can occur even later, which can present 6 to 12 weeks after the primary COVID. Okay. Those complications also can be prevented.
Okay. So I think again here key is vaccination for each and everyone, and now that children are getting it, it's important that we get it from them. So on that note, we're going to be taking a short break. We'll be right back. Welcome back. You're watching Health and Wellness Myths versus Facts. Dr. Bhavanadhar, with aging, there are changes in the cardiovascular system which result in alterations in cardiovascular physiology. What are the changes of aging associated with the cardiovascular system? Can you tell us about that, please?
Sure. Many of them have the doubt that aging definitely affects the overall health of the person. But cardiovascular system as such is one of the system where the vascular part, the blood vessels, they become stiffer as a person ages. And there is also an apparent increase in the blood pressure, because stiffer blood pressure, more difficult to compress, so the actual blood pressure may be lower than the pressures which are seen by the apparatus. Apart from that, aging related disorders like, as Dr. Naik said, diabetes, hypertension, their prevalence increases with age. Both these disorders again affect the cardiovascular health, causing increase in the coronary artery disease, increased risk of stroke and heart attacks. But again, it depends upon their diet, exercise capacity, which leads to the aging in the cardiovascular health and also cardiovascular system.
Okay, so diet and exercise does play a key role to keep your heart to keep your heart healthy actually. Dr. Naik, how frequently should older people with comorbid conditions like diabetes, hypertension go for blood tests and other tests? And what are those tests? Because sometimes, they want to go to visit a doctor, but they don't know what are the right tests to be done to take care for prevention.
Very practical question, madam. Yes. For a diabetic people, to keep them to live an healthy diabetic life, we need to keep the targets very much in the normal limits. So to keep the normal limits, we need to check them very frequently. So for elderly people, if they're, we do advise at least once in 3 months to follow up the test, the set of tests to be done in regularly. So if they're doing really in good control, we do leave them for 3 months. If the sugars are under not control, metabolic values are not under control, we do call them at least once a month. So whenever they come, we do some basic tests such as fasting blood sugar. So with the test which is will be done in the morning, at least the person who is getting it tested, he should be fasting at 8 to 10 hours. That means he might have taken the last meal at least 8 hours back.
Okay.
So that will be considered the fasting blood sugar. And we do ask them to have a breakfast or the lunch, and we do check the post-lunch or the post-breakfast at least 1.5 to 2 hours after the consuming the food. That is called as the post-prandial blood sugar, the PPBS, what very commonly called as.
Okay.
And we do check an HbA1c, which gives the past 3 months average blood sugar. And with that, we can assess how best the gentleman is doing the glycemic control, the sugar control. Sometimes the fasting PBS can deceive us, but HbA1c gives us a clear picture of how best he has controlled. And that can be used as a prognostic marker how will be his diabetic life. So these are the basic things, and along with that, we do CBC, and at least once in 6 months we do ECG. And to rule out the cardiovascular complications, we do ask them to get echo and TMT done at least once a year, so that we can keep them healthy, happy, and away from the cardiovascular complications. And also, we do check their foot in every visit, so that they shouldn't have any foot complications such as foot blisters, and they may end up into, because of that, they may in future they may have a diabetic foot complications, gangrene, and all these things. In order to prevent them, so we do check their foot in every visit, so that they should, our elderly person shouldn't lose their foot, healthy foot, and they should be walkable and they should be ambulatory all the way. So in order to prevent those things, we need to check them every visit, and we do counsel them, psychosocial counseling, dietary counseling, and counseling for the to keep them physically fit and active. So we need to motivate them to be healthy all the time.
Okay.
So the basic tests, which are the set of tests, the fasting, PPBS, HbA1c, CBC, serum creatinine, and ECG once in 3 months. And once in 6 months, we do go for echo TMT and fundus check at least once in 6 months, so that we can prevent the diabetic retinopathy or eye-related complications, what we call as. So our elderly people should be free from the micro and macrovascular complication. Micro is the complications what we call as complications related to the eye, kidney, and nerves, where the macrovascular complications are things which are related to the heart and our brain. These are the things we need to keep under control. So thus we have to do the test very frequently and keep the values as normal as possible, so that they won't land up into the complications, such as whether it's a micro or macrovascular complications. Thus, we can give them a healthy diabetic life, and we can keep them free from the complications. So one mantra, what I can say to the viewers through our NDTV partners, so the Mool mantra to keep the complication away is diabetes control, 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 proper diet, drugs, and doctor. The 3 Ds can keep your diabetes under control.
Absolutely. I think that's a very key point out there, which you've pointed out, Doctor. In fact, what you also said rightly, that, it's important that, preventive checkups are done for further complications. I think that's, again, a very key point. Dr. Bhavanadhar, heart health does deteriorate with age, but still we can see aged people who are perfectly healthy without any cardiac ailments. What could be the reasons for the same?
Yeah. I think this may be the question going on through many of the people, because we are seeing in the news younger people getting heart stroke, brain stroke, but elderly people who are of age, but they are very fit, some of them. I'll say everybody is different, and everyone's health system is different. Again, it depends on comes to our diet and the exercise, and it should not start with the start of a disease. Like after once hypertension or diabetes detected, people become aware, then they start doing exercise, and then they follow diet. But it should start at an early age, at an younger age, and optimally, never overdo it. So the diet should be which is rich in fiber, leafy vegetables, salad, and colored vegetables like carrots, tomatoes, which are fresh, and less in content with salt, less oil, and the exercise should be optimal exercise. The recommended is at least 45 minutes of brisk walking or jogging, or any exercise where we move, like cycling, and swimming is the best form of cardiovascular exercise. At least 45 minutes per day, 5 days a week. And it can be done any time in the day. So exercise and diet makes a lot of difference, and especially from an early age, which keeps the heart and cardiovascular health in a good way.
Okay, thank you so much, Doctor, for explaining that. I think the main thing what here we're trying to really understand is to stay healthy. It's not only that when you get to know you have hypertension or diabetes, we start taking action and taking care of our food and exercise, but it's important that we start doing it from an earlier age. So it's important that exercise, sleep well, take care of your health. Thank you all so much, doctors, for joining us today. Thanks for watching.